We're good with that.
We are recording.
We'll need to turn these people back on because they're not.
Yeah,
This is,
they're
okay.
Can everybody hear us now?
Yes.
Thanks, Liz. Sorry, I don't know, it's my fault or something, I don't know what's wrong. So
Thank you.
we had some, we thank you for your patience, we had some technical issues. So anyway, I'm Jason Jones. I think everybody that's here knows us. And those who will watch this later, if you don't know us, we're with Wellness Edge, and we are we'll talk about the next grant cycle, year 2. Lindsay, you want to introduce yourself?
Absolutely. I'm the Inclusive Health and Wellness Director at the Human Development Institute. So I function on the Wellness Edge grant to provide technical support and assistance. I don't review any of the grants, so I'm happy to answer any questions or help along the way as you're writing. Because then once you get funded, hopefully so, I'm the one that helps provide you with all the information to promote you being successful. So excited to be here today.
So before we get started, we have to read the disclaimer. Liz, you want to do that on getting this
Sure,
set
yeah.
up?
The project described is supported by a grant number, a lot of numbers there from the ACL, Department of Health and Human Services. Contents are solely the responsibility of Wellness Edge staff, do not necessarily represent the official views of the Administration for Community Living or HHS.
Okay. So the people on the Wellness Edge team, Lindsay and I, of course, we've already met. Danielle Augustine, who is
On our way.
she's on her way, okay? And her role is for facilitation and for communication. And Danielle, those of you who have worked with Danielle, she's really easy to work with. And Chipper is our PO on the project, and Kathy Shepard-Jones as well, who is the director of HDI. And you, of course, are sub-awardees. So if you have any questions, we have a dedicated Wellness Edge email address, and we like to keep everything there if we can, instead of communicating personally through each of us, so we have a record of everything that goes on and we can all sort of stay on the same page. We did produce a frequently asked questions answer sheet before, and that is available on the website. And as we get more questions that come about for this year too, then we'll do those. We'll update that document too. So you want to talk about the website?
So the website is wellness4ky.org and then /wellness edge. So we have all the information about the grant. The application link as of this morning is now live. And then there's also a downloadable version if you wanted to have something like a workable document, but then you do have to click the link to upload that information. We have all of our sub-awardees from year 1 also listed there, so you can check out and see what they did, who they are, and the cool things that they're doing. And then any additional information or documentation that we have that is in reference to the grant is all accessible on that webpage.
And that is where you will find the frequently asked questions.
Yep.
Okay. Any questions so far? I'm going to go a little fast because I know we started late. But so today we're just going to talk about a couple updates on the year 1 project, so you can kind of see things that were funded for this first year that are ongoing as we speak, and a lot of those are really ramping up at this point. The proposal criteria. We'll talk about milestone payments, which is a very important thing that we figured out through round 1. Just some things to consider and some advice and frequently asked questions. So here's a couple program examples. So Bluegrass Tennis Association, the wheelchair tennis program is a partnership between Bluegrass Tennis Association and Bluegrass Racquet Club with support from Easter Sales Cardinal Hill. And the project was designed to provide a wheelchair tennis program pathway to attract new players and give players opportunities to be frequent players. This is a program that was not in existence before, this is the kind of thing that we're looking for, is someone who expands something that they're already doing to include people with disabilities, people with spouses. And the Bluegrass Tennis Association is one example. So you want to talk about TURP?
Sure. So the goal of TURP was to allow students with mobility issues to participate in physical activities and with support networks, and to do so in inclusive wheelchairs, and doing wheelchair basketball and other team building activities. And so this has been an incredible partnership because this is through the Fayette County Public Schools. So even though the director of this grant is at Bryan Station High School, that equipment was purchased countywide, and is a program offered countywide, which is really incredible opportunity for individuals with disabilities as well as their peers, their caregivers, to be able to partake in adaptive sports and recreation in a fun and engaging way. And we've got some really, really cool feedback from this group with school-aged youth. So really excited about this one.
Yeah, and something I would add is really cool about this, and what Lindsay touched on was the integrated part, because it's really cool that there are people that are not wheelchair users that are participating as well, just to get that just experience. Yeah, exactly, which is great for everybody in the program. So we like inclusive programs. So the Gathering Strength Fund, that's Liz's group. I think Liz is on the call. The Gathering Strength Fund assists low-income people living with paralysis participate in the therapeutic exercise opportunities at Fraser Rehab. And this is an interesting grant, because when we first looked at it, we thought, well, we really shouldn't fund a grant that has the backing of Fraser Rehab, because it's a huge, it's a huge facility. We felt like they could provide their own funding, and if they wanted to do that. But then digging deeper into it, we found that basically that the group is basically renting space there, and they're not funded by Fraser. In fact, they pay Fraser for the space, and this has turned out to be a phenomenal program. They've met all their milestones and their marks that they were looking to do. They've got people on waiting list, I think, even to fill all their spots. So, and this is phenomenal. When you see this lady in the picture, she's getting great. Not just the actual therapy and the exercise, but also the fact that other people are there and she integrate with other people that have some similar goals. So.
And so this particular program allows for individuals who have perhaps finished their therapy, their prescribed therapy, to be able to still access that equipment in a recreation format.
So Easter Seals Adaptive Water Sports.
No, so you want me to talk about it?
Yeah, Cindy is the director of this program, and this is really one thing we really like about this is that it's in Southern Kentucky. We didn't get any other proposals from that area of the state, but they're doing some really cool stuff. They're doing sit water skiing for people with paralysis, and some of the pitfalls that they ran into are some of the things that, of course, there's a big legal issue with providing this type of recreation. And I think you've worked through all that now. And storage for the equipment, and figuring out who's going to rent it out or to be there. I'm sorry. You don't rent the equipment, right? You can just set up appointments, or how's that work?
We're going to have a big event,
Right.
To kick it off for the grant. And then we're still kind of working through the rental process, because we're a nonprofit, they're a for-profit. How do we match that? So that's where we're still in the hopes is June 27th, we are going.
Great. So that's that. And if you're in that part of the state, I'm sure I would love for you to participate. So for help, we talked about this a minute ago. That's the website, and that's where you go for all things Wellness Edge. So I think Chicken wants to show the website. You click on that link.
Let's see. I cannot.
Okay. So that is the website. Sorry.
Do you want me to try?
No, that's okay. So grant writing tips, Chip and Lindsay are available to do that. So if you can contact them through the Wellness Edge at uky.edu for any tips.
And there's also a document on the website as well with just an overview of grant writing tips.
Did you guys control of the draft?
No.
Okay. Well, we talked about it. I think it's on there. So go ahead. So here's some proposal criteria to remember. First, proposed activities must take place within a 12-month period, July 1st through June 30th of 2020. And this is a little different than last year because our funding didn't start for the first 2 or 3 months after we received the grant, because we actually received the grant on July 1st. But we could not dispense that money until we had set up the infrastructure and all that kind of stuff. But for this year, June 1st will be the grant cycle start, and hopefully all the paperwork and everything is in. Our grantees at that point, you can start spending your money and running your programs. But proposed activities must conclude by June 30th, which means you have to. Actually, I think our billing was before that. I think it's the 25th.
Right, because then we also have the evaluation component to finish up the grant that you would want to have submitted.
This was a question I got from a group that was going to, I think is going to apply this year, because they were going to do to propose a camp that happened in late May. And so, and this was obviously for your for this year. That's been close to the line. We're close to the line. So for next year, June 30th, all money has to be spent. So there'll be an emphasis will be placed on education, training, providing service. Okay, this is something we talked about a lot last year with our grantees, and we actually, some people that did not receive an award, it was because of this. The grant application that proposes an archery camp for individuals with paralysis will have more emphasis in the grant proposal on having an exposition fair for adaptive equipment. Like, showing it is not what we're looking for. Having people do it is what we're looking for. So everything, emphasis will be placed on expansion of scope of current projects. Last year we had someone apply that wanted to go to a basketball nationals. It was an already established group with 12 members or so, and they were looking for funding to send in there. That's not what these projects are. These projects are, if that same group wanted to start a new team, if they wanted to start a youth team, if they wanted to expand equipment or outreach to the community in some way, then there's a higher emphasis put on that than somebody that's just simply trying to do more of what they're already doing. We're looking for new, innovative programs.
And I'd also like to emphasize that the infrastructure to support individuals with paralysis or disabilities does not have to be existent. We've also gotten questions from organizations that are not disability focused. And so obviously that is also a huge emphasis of this grant, is to provide opportunity to become inclusive, to be accessible for individuals with paralysis, and therefore more broadly accessible to everybody. And so that is a big emphasis as well for this grant. So make sure to make that known.
And the best example of that for this year is the Bluegrass Tennis Association, because Bluegrass Tennis Association had no program for people with paralysis, and they used this grant in order to start a completely separate and new opportunity. So applicants must be Kentucky-based organizations. That was an issue we had last year because of some people who wanted funding in the Bowling Green area, and it was a national group, but they had a chapter in Bowling Green, but the organization has to be Kentucky-based. Applicants must demonstrate an ability to provide structure or organized group activities which are intentionally designed to benefit individuals, groups, or communities. Okay? Makes sense? Pretty straightforward, right? Preference will be given to applicants committed to providing inclusive activities that are not aimed solely at people with disabilities. And this was one thing we really liked about the TURF program, is there's a great emphasis on let's get everybody out there and no one feels like they're being individualized, right? So, applicants should use person-first language or refer to people with disabilities. You know what person-first language is? Everybody in this room does, I'm sure. So we avoid words like handicap and cripple and those kinds of words, and we make sure that we emphasize the person first, right? Person with paralysis. So upon acceptance of the proposal, awardee agrees to work with Wellness Edge staff, that most of are in the room right now, or online, to enter the University of Community online subcontract system. And Cindy can tell you days about this. This is kind of a headache, but we've learned a lot the first year as far as getting those contracts set up, and we hope for a much smoother transition this time. Award payments will be made based upon completion of project milestones, which we'll talk about in a minute, with final award payments upon receipt of final report and final invoice. And final report and invoice must be received no later than June 25th, so we can close out. So some milestones examples. So we'll talk about milestones now. Some milestone examples. Do you want to explain milestones? You want me? I can do it.
Yeah.
Okay. So this is just one of the projects. The Spinal Benefit Association of Kentucky is doing a summer camp. Their original budget they asked for was $10,000. And remember, these grants can be anywhere from $10,000 to $24,999. And the way that we do this is because a lot of these are heavily loaded with equipment and some things that you need to purchase. Here's some examples of some milestones that we use. And each one of these, we assign a number, amount of money. And so after the announcement and promotion for SB, yeah, I'm sorry, I can't read that. Terrible. SB Family Camp in October, they were able to bill for that after distribution of newsletter to 1,200 families. So you see there some of their outreach materials. They were able to bill for that amount. And after identifying 37 campers in their immediate families, they were able to bill for that, and then there's a small amount at the end to make sure we get that final report back. So, and we do these, go ahead, we can just flip through these real quick. Here's another example. This is Easter seals. And how did you feel this worked? Did you feel it
Once
worked?
we understood
Once you
how to
understood
do
it,
it,
right?
it totally makes sense.
Okay.
Yeah.
And we did, go ahead.
I was just, so the reason it matters now is that as a part of the application, your budget that you submit, you'll need to identify what those milestones will be.
Right. And these examples will be available for anybody that's applying for a year or two. And the really great thing about this is that a lot of people need to be able to pay for things up front, and we want organizations that don't necessarily have any money, so they won't have to be reimbursed this way. They can actually get money and then they can purchase their equipment. Okay. So this was Easter sales. Now here's one that was $25,000. This was the statewide introduction of adaptive sports clinics. This was done through Vicki Link's group with the PVA, the Paralyzed Veterans of America. And these are three separate. You went to one this weekend. Yeah. Do you want to talk about that?
Sure. So the clinic had all types of adaptive recreation equipment, and so as a participant, we were able to try everything out from bocce ball to the sports cheers to do wheelchair basketball, archery, shot near rifle gun. So a great opportunity for individuals with paralysis as well as not, well, veterans as well as not, to get to enjoy that recreation opportunity, and then hopefully set up an opportunity then within the local Parks and Rec to engage in those recreation events. And so it was really great clinic.
And the interesting thing about these milestones, if you look at these, none of these are payable after any of the clinics were done. These are all things leading up to planning for the committee or for the actual clinic. So you really didn't have to conduct the clinic before you could receive the money, and that was so you could finance everything you needed to put on the actual dates. So requirements, things to consider. So wellness aids will not fund the following, okay? Organization overhead expenses, all right? Do we understand that? We don't pay rent, those kinds of things. Got it? Okay. Medical services, fundraising activities, all those things have to exist outside, okay? And new construction, with the only exception being if you had a building that needed to be made accessible in order for your program to be able to be used, you could do that. Or like for instance, Cindy, if y'all needed to build a ramp on a dock or something to make it accessible, then those situations would be good. But you can't build a building to keep your equipment. Okay. So data reporting. Do you want to talk about this?
Sure. Yeah. So it's important for us to know numbers. That matters. And so with the things that we need to consider are how many people are being served by your program or service, individuals with paralysis as well as those without, individuals in their support network or community members that are accessing the event. And then how will your event get feedback on whether that be an event, a camp, or a service? We provide surveys, interviews. Surveys are typically the easier opportunity, and then part of the Wellness Edge supports team can help with that. And then who administers the registration form or the surveys themselves? When do you do that? These are all things to think about that will be important to consider within your evaluation component of your application, knowing that you do receive technical assistance from our team with that.
This is for disability specifically for paralysis,
Yes.
or other disabilities?
It's got a paralysis emphasis, but the nice thing about making something accessible and targeting individuals with paralysis, you're making it more broadly accessible for anybody. So, so I think that that's a good question. Yeah, it definitely does. So wanting to be able to capture that to also then report back to our funders at the nationwide level to show, by broadening our definition, this is how we're able to benefit the community, not just for people with paralysis.
I think the exciting part of this too about the data reporting aspect is that we have a whole year of people that are doing this now. And so we'll have good examples of sort of what kind of things that they've done and some mechanisms that they've used in order to be able to get this data to us and we should have some final report examples here.
But even if you're not necessarily a numbers person or really interested in evaluation, hopefully you can see the merit and worth to gathering this information and know that it's hopefully not something that's intimidating, but important, and obviously we're here to support you.
So also things to consider, this is something that we ran into this year, of the purchasing of equipment. Before you purchase it, where are you going to keep it, right? That's important. Will it be stored in a separate place during an off season? Like that would affect Cindy's group because obviously water sports aren't happening in February in Pulaski County. Well, they may be, but they probably shouldn't. Who will be responsible for maintenance? And that's an important thing. That's a question we have with TURP because they were purchasing all new chairs. I mean, are the people that you're purchasing from going to be responsible for taking care of them? Is there a contract in place for that type of repair? That kind of thing, especially when you're having sports where people bang up against each other, right? Since chairs can be damaged. So do you have staff or contacts who can do the repairs actually if they're on site somewhere and something goes wrong? Okay, things to consider. So also your outreach materials needs to be inclusive and accessible, right? So if you use a website, it needs to be accessible. You need to have large print available, those kinds of things. If requested, doesn't necessarily, you don't necessarily have to cover all the bases unless it is requested. It needs to be administered in a variety of ways, right? And some examples, of course, would be social media, could be anything from radio ads to posters to all those types of things. It needs to be available in several ways if possible. And that's just a good marketing idea, right? Nothing else. And reach out to other community partners who will help promote the project. And I think that's super important, especially in your grant writing proposals, because letters of support from community members that may help with the program is super important. So consider those people. So this goes to what I'm saying here. So who would you like to partner with in the future? Right, something to consider. How can you involve them in the current project efforts? And letter of support, as I said before, organizations with your proposal. It's critical and funding. Okay, you want to talk about the monthly calls?
So we do have technical assistance calls every month for our sub-awardees. We do those typically on a Tuesday, middle of the month. They last, we say 30 minutes, but after the first month, they all average somewhere between 10 to 15. We usually can get your questions answered pretty quickly. So knowing that that's a part of the support that you will receive, as well as a requirement to participate in those monthly calls for check-in. We talk about all the financial updates, any activities, discuss those numbers that we talked about for evaluation, see what kind of challenges that you might be having and ways that we can support you, and then looking for opportunities to broaden your reach or think through different things. And so we've actually a highlight of our month. We have them tomorrow.
Tomorrow, that's right.
Yeah. Mm-hmm.
And they are required, by the way.
Yeah.
Yeah, it was on there too. Saw it as you switched to the next one. So a calendar of events, we have a community calendar of events that we use. A simple form to fill out when something's going on. It is separate from the grant timeline, okay, that you create in your proposal. These are things that once you schedule them, because you may not know those dates, of course, when you do your grant proposals. And you have to keep the Wellness Edge team aware of your activities, right? So we can participate, we can promote, and those kinds of things. And give good examples for other groups that may want to steal your ideas, because we're not in silos here, right? We're trying to all help each other and help the state become more inclusive in recreation for people with classes. So this is the last slide. I told you we'd make this quick. So dates to remember coming up, okay? The application is actually live now, right? Have you checked it today?
No, but I've not been in front of the computer. But according to email, traffic and
All right.
is on the
I
call.
had a conversation with Chipper this morning, and I know we were on our way, so because it was not working as of Friday, but it's good. So that it is live now. May 8th is the deadline, so it gives you about 5 weeks from today. This is not a extensive application like you find in large grants. This can be done in a few days, and especially if you've written anything like this before. It's not crazy, right? Would you say, Cindy? It's not.
It was pretty easy, yeah.
The review of proposals will take place between May 9th and May 22nd. There's a group of 10 people, individuals who some or all or have some sort of stake or are a stakeholder with people with paralysis. We divide all of the applications up into 2 groups of 5, and they're scored on an individual basis, and then that score wins, right? As far as how much funding we have. The Chipper did say it's live. Great. So we will notify applicants by June 1st, and we use that month of June in order to get all the paperwork and the conflict of interest and all those forms that we have to do to get started and set up the accounts with UK. And hopefully, everything goes well, July 1st will be the funding cycle. So we'll start from year 2 forwards. Okay. So that is all we have. So do we have any questions in here or online or, well, I knew you have a question.
The wheelchair basketball thing, you said, like, if they have to show how they're to repair that, you know.
What we're looking for is program control after this grant cycle. So if the purpose of that program was to purchase it, obviously, if someone's willing to do that from as far as administering the program, there's really no reason for funding anymore, except for the fact that those chairs have to be. So you need to make sure you identify before you go out and purchase it. Make sure that there's some it's basically. That's obviously 10 chairs, you damage them all in the first month, and there's no funding for that anymore than takes care of it. So the grant's not going to pay for it after the first year.
Right, but do they have to have a funding source to pay for it? Like, you said some of these organizations don't have money.
Ideally, if you went out and you spent $2,500 on a chair, there's some sort of a guarantee or a warranty or that kind of stuff on that chair for a certain amount of time. So, yeah.
I have a question. So I submitted last year. My only issue was I had more than one document, and so that complicated things because it said that there was more documents that could be uploaded. So could you guys like check that? You know what I mean? Like to make sure when you make it live to see if you can submit more than one document?
Heidi, what do you mean, like for the proposal? Or
When you fill out everything and have it in a document and you upload it on the site, there was only able to upload one document. Do you see what I'm
Hi,
saying?
Heidi.
Yeah.
I do. So one of the big changes that we have made this year is it's going to be like filling out a survey. So they're going to be big text boxes. So the only thing that needs to be uploaded is the budget. And if you're, say, working with another organization, it's the letter of support. But all other things, you can just type it in directly into the online form. Yeah, so this would actually reduce the number of things that needs to be uploaded.
Fantastic.
The budget,
Okay.
yeah. And as always, you have our email address. So if there is ever a glitch, just send us a note and we would always, we can troubleshoot it with you.
Okay, great. Thank you.
Any other questions?
Yeah, I have a question.
We're out of time.
Oh,
Okay, kind of just
look at
give
that. Look at that. Don't mess with me today. Is there, with other federal grants that I have been a part of, there is a limit on, I think the proper term for it is administrative costs, the cost of administering the program as opposed to program costs. And I'm wondering if you all have that kind of limitation. I think it's 10 or 15% can't, the budget or the cost can't be, administrative costs of more than 10 or 15%, I don't know what the cutoff is, can't be, it can't be more than that in the budget. I don't know if I can complete an actual sentence here. I'm trying.
Yes. So the short answer is sub-awardees cannot charge administrative costs to this grant.
Okay.
So all the costs have to be linked to milestones. That's the shortest answer. We, as people who receive the money directly from the feds, have to pay indirect. But you all don't have to worry about it. You all cannot charge the grant for indirect.
Okay, well, I may offline just make sure that we're talking about the same things. Maybe I'll email you because I think I understand what you're saying, but I don't want to take up a ton of time going through every detail on that.
Well, and Liz, we can talk about it tomorrow on our
Oh, okay.
on our monthly call. We can, Jason and I'll touch base with Shifra and make sure we have the information to talk with you with details tomorrow.
And then the things in the slideshow right here that we've had, that you've provided us, the things to consider and the things that are the most important. Are you going to email, will those be available for us to look at after this video conference?
Yeah, we can upload this on the website. Yeah, we can upload on the website, and I'll just send it to you too, Liz.
Okay, well, I looked on the website and I'm probably missing it, but I couldn't find exactly what you were showing on these slides, but I may have.
No, it's not up there yet.
Oh, okay, got it.
Yeah, but I'll send it to you this afternoon.
Okay, thanks.
Okay. And anybody else just that wants the PowerPoint, just send it to the Wellness Edge at uky.edu, and I'll send it out to you, as well as this is being recorded, and we can send this recording to you. Maybe.
Got it right.
So any other questions?
I'm pulling up the Wellness Edge website. So click here to apply. The tips for applying are here. You can download the workable application.
Is that showing you where?
It's not showing yet.
Are you looking at the tips for applying right now?
I am. Here we go.
Yeah, I looked at that, but it didn't seem like it was the same. I was looking at the same time you were doing this to make sure I.
Yeah, it's not.
Yeah, no, this is a Word document.
Oh, okay.
You got to stop sharing that screen.
I did. I hit new share.
Okay, so anyway, it'll be there. We'll get it to you for sure. Okay?
All right.
Sandy, you good? Okay.
Now can you see it, Liz? Okay.
Oh, yeah.
This is just a Word document that has information on there about tips for applying. And so Danielle will add these slides and then the recording of this webinar to the webpage as well.
Okay.
But then if you click on sub-awardees down at the bottom, that's where the FAQ document is.
I didn't look there, so that's helpful. Yeah.
Yes, I think it's maybe a little bit misleading, but that's where it is.
Great.
Yeah.
All right. Any other questions?
And if so, email them to wellnessedge@uky.edu.
Thanks, y'all. Appreciate you being here.
Thanks.
Thank you.
I'm gonna stop the recording over here too.